Today, I am excited to welcome Dr. Daniel Rafie to the podcast. Dr. Rafie is a sports neurologist and traumatic brain injury physician based in Southern California. Jealous. He completed his adult neurology residency at Hackensack JFK Medical Center in New Jersey and went on to receive advanced training through the prestigious UCLA Brain Sport Fellowship in sports neurology and traumatic brain injury. So currently, Dr. Rafie is the host of the wonderful UCLA Brain Sport podcast, which I highly encourage you to check out, where he dives into topics around brain health, injury management, and performance optimization, featuring insights from leading experts and athletes alike. His expertise lies in concussion management with a focus on innovative intervention techniques, and he's actively researching the therapeutic approaches, including the potential benefits of CBD for concussion recovery. Dr. Rafie is also passionate about optimizing neurological performance in athletes using non-invasive neuromodulatory techniques and advanced psychological. I cannot read. I'm so nervous, Daniel. Monitoring. But today we'll explore the complexities of PTSD, the cutting-edge advancements in brain health, and the practical steps you could take to optimize your mental and neurological performance. So whether you're interested in the science behind trauma resilience or you're just looking for ways to keep your brain healthy every day, I think this episode is going to have something for you. So please join me in welcoming Dr. Daniel Rafie as we explore his fascinating work when it comes to this intersection of sports and brain health. Dr. Rafie, wonderful to have you on. How are you doing?
Thank you so much. We should just jump into it, man. That intro you gave me way too much credit for some of the stuff I'm doing.
I
I
yeah,
think that was your own way, that was your own, like your subconscious way of saying, let's cut this out already. Let's get into
yeah,
it.
I'm very excited to dive into it. I think when we met previously to brainstorm around topics for the podcast, like there was so many different directions that we could go. But I do want to start maybe with something you're deeply passionate about, and that's understanding just the complexities when it comes to PTSD, and then when it comes to trauma resilience as well. So I definitely like to start there. I know you told me an anecdote when we last met. You said that someone could, or a bunch of people could experience a traumatic event, but all react in different ways. So I think let's dive a bit into that, if that's okay with you.
Yeah, man. I think my interest in post-traumatic stress disorder came from when I was doing my fellowship and continuing with the kind of work that I do in brain injury. The mechanism by which people have brain injuries is obviously physically traumatic, but can tend to be mentally traumatic as well. I was seeing military veterans, that were exposed to IEDs, blasts, other kind of combat fights. That's where they sustained a brain injury, where the concomitant PTSD diagnosis was just rampant and just so common. So, I can understand concussion, brain injury, and the symptoms related to that, but if I didn't look into post-traumatic stress disorder, understand its nuances, as well as the overlapping symptomatology between PTSD and brain injury, I think, would be very limited in the kind of care that I would be able to provide these patients. So that's really where, it came from. And then, the more, so I think when you look at pathology, whether that is, physical, brain injury based, or psychopathology, a lot of the things that would benefit you in a pathological state, you also find that they can help you in a non-pathological state too. And that is also an interest of mine, where you begin to notice a lot of the recommendations, a lot of the things that we're doing for people with post-traumatic stress disorder, also with people that are worried about optimizing their brain health, people that are worried about preventing cognitive decline and dementia. There's a lot of overlapping recommendations amongst all of those pathologies, right? And that's something that's also particularly interested me. And I think the case that you talked about was, the anecdotal case that I told you about was, you got a group of guys out in the middle of Afghanistan riding down, a road, and there's, four military soldiers in the car, all similar age, and they get blown up by an IED. They all suffer concussions. They all lose consciousness, but only one of them will develop post-traumatic stress disorder, right? So you look at that case and it's, what is that? Was this person particularly exposed to the blast? Was it a function of their brain injury? Or is it, something else? Is it the genetics and their past experiences growing up that they went into that event with? It really leads to me, at least, asking myself a lot of questions about what is that discrepancy? Like, what is that, right?
Yeah, it's an interesting question. You actually, I was thinking about this previously, but you just said something that sparked even more thought for me. Was like, I was assuming, it's the exact same event, which it is, but there could be different outcomes to that. Like someone could have been like closer to a flame, or someone could have lost a limb versus not lost a limb, or yeah, I forgot about those kind of differential factors as well. I'm curious from your point of view, like let's dive into that a little bit. I know you mentioned genetics, but like why do some people develop PTSD while others don't, even if the experience is similar or the exact same in the traumatic event?
I mean, I think there's no black and white answer, right? There's, we're not clones of each other, not only in our genetics, but also in our experiences leading up to whatever event that can potentially traumatize us, right? So, we can talk about the environment and your past experiences leading up to that event, for example. Like, I like pointing at adverse childhood experiences as an example of that. So adverse childhood experiences are significantly associated with mental health, adverse mental health outcomes in the future. And if you want to talk about post-traumatic stress disorder, it is associated with an increased risk of developing post-traumatic stress disorder after a traumatic event, right? So, and you can do an adverse childhood experiences score, right? So they have scales and scores that you can do. And it goes from 0 to 4, and every increase in score could potentially increase your risk of post-traumatic stress disorder by about 7%.
Is just to clarify, sorry to cut in, is this doing a test on an adult, like reflecting on your childhood, or is this doing an actual test on a child predicting what they might be like in the future?
No, so it's retrospective. A lot of these questionnaires, well, they'll just ask you regarding your adverse childhood experience as a child. And adverse childhood experiences, they can vary, right? Like, the typical ones that they ask about are interpersonal violence in the home, sexual assault as a child, substance use in the home as a child. And they've also included like your parents getting divorced, right? Like, so I think an issue with the questionnaires also is regarding, is, for example, sexual assault as a child the same thing as your parents getting divorced? Like, I think logically we would say, those are obviously two different severities of adverse childhood experiences. But either way, I think the field of adverse childhood experiences, considering them and then the outcomes from a mental health standpoint, is still in infancy and growing. And we'll probably be able to hone down a lot better the adverse childhood experiences, the specific adverse childhood experiences that factor in the most to adverse mental health outcomes, including PTSD.
That's so fascinating, and what it's got me thinking of now is that you've highlighted the adverse experiences that affect maybe vulnerability to PTSD. But like, what about the flip side? How do positive childhood experiences, or maybe I don't know, is it limited, like strong parental support or otherwise? How do they contribute to resilience then in later life?
Yeah, so that's an excellent question. And it's not all doom and gloom, right? So positive childhood experiences can actually be protective against the adverse long-term mental health outcomes of adverse childhood experiences, right? So they've found that if you've had 6 to 7 positive childhood experiences, that can actually have like a 72%, you actually have a 72% lower odds of developing adverse mental health outcomes as an adult, including depression, right? When you compare it to people that have only had like 0 to 1 positive childhood experiences, which is huge, right? And you know, positive childhood experiences would be, for example, feeling safe in the home, having, I think, 2 non-parent adults in your life that you feel are there for you and supportive, for example. And can't really think of the other ones right now, but those are 2 really good examples that typically are used in the questionnaires.
And it's just striking another question to me. So you have the kind of setup, and it also, when you started, I don't know why Maslow's hierarchy of needs was coming into my head, and it's like really having the foundational ones like are very, very necessary. But what about other areas, like maybe interventions? Like, are you an advocate for social support programs? Are you an advocate for therapy at that age or anything like that?
Yeah, I mean, absolutely, right? So, you know, I think a big issue is you have adverse childhood experiences and then you internalize those feelings, you don't communicate them with somebody else, and then that just becomes part of the way that you see your environment and the world around you. And then that ends up leading to a state of chronic stress, hypervigilance, that that state of being can then be the factor that then predisposes you to post-traumatic stress disorder. So, for example, not necessarily relating to childhood, but there was a study that was done regarding the Korean War veterans, and they found that one of the biggest predictors, if not one of the biggest predictors of developing post-traumatic stress disorder as part of their participation in that war was a quote unquote malevolent environment. So that's like, you know, not having enough food, bugs all over the place, heat, right? So, you know, the bugs aren't causing you to have post-traumatic stress disorder, right? It's just this constant state of stress and constant state of irritability, and again, stress that then when you have a superimposed, really traumatic event could be the tipping point, right? And you don't only see this in Korean military war veterans, but then you can expand it out to like police officers, right? So they're particularly predisposed, that's an occupation particularly predisposed to post-traumatic stress disorder, but you know, they don't just have one traumatic event that they have to deal with, right? They're, as part of their line of work, they're constantly in a state of stress, right? Every time they pull someone over in the car, they're coming up to that car under a state of stress of, is this person going to pull out a gun and shoot me or not? And that's, you know, how they function on a day-to-day basis. So functioning on a day-to-day basis in a state of chronic stress, and then let's say something traumatic does happen to them, like they do, you know, get shot as part of the line of duty, that can then be the tipping point.
Just pushes you over the edge at that stage.
Yeah.
What do you think, sticking with childhood for a second, what do you think about maybe today's society or Western society? I don't expect you to know about Ireland in particular, but it's very, very similar to the US, I would suspect. But I'm curious, when you mentioned childhood and we talked about the social support networks they need, like potential maybe interventions, maybe this is just because it was my upbringing, but like my mind automatically went to sport and the fact that I was out interacting, being active, kind of engaging, like leaving my feelings out either through verbalizing or just through sport as well. I'm curious, are you thinking, do you think PTSD could be brought on more so today by the way maybe kids are growing up? And I am thinking not just household situations we mentioned, like the 2 parents could be a big one, a good environment, but also factors like online gaming. You know, now I see them more, they're isolated to themselves, even though they can probably chat virtually, but versus maybe the old school, like getting out into the community or being involved in more social support networks, including sport.
Yeah, so let me just say social support is one of the biggest factors and predictors of post-traumatic stress disorder, both prior to and after the actual traumatic event, right? And what's interesting that's been noticed is positive support can improve the symptoms of post-traumatic stress disorder and potentially avoid the development of post-traumatic stress disorder. But I think the evidence is more robust for the flip side of it, meaning negative social support is much more harming for post-traumatic stress disorder symptoms and the development of post-traumatic stress disorder than potentially the protective effects of a positive social support. So my sense would be the most important thing to do is if you're in a negative social support context after you suffered a traumatic event, one of the most important steps moving forward would be to extricate yourself as much as possible from a potentially negative social support system. You bring up the video gaming and isolation, and I can certainly see that perspective, but you know, when you and I grew up, you know, the whole gaming and our social network wasn't really online, and it wasn't really around gaming. Like my social support or my social network gaming would be like, you know, we're playing on one computer and my brother's playing and I'm next to him just trying to, you know, be involved with the gaming process. And it was more of an in-person thing. But I think you know, I would be cautious about saying, okay, these kids are just isolating themselves, when in fact, a lot of their social network is online and is through this whole gaming apparatus. And I say that like, for example, you know, like bringing it back to a different pathology like brain injury, right? So screen time has been something that is really up for debate as far as after you had a brain injury, right? So like after you have a concussion, how should we moderate screen time? Should we say no screen time at all? Should we say, yeah, go ahead, have all the screen time you want? You know, and one of the big factors in the conversation of moderating people's screen time would be, well, you know, what are we going to tell kids to not be on their phones now? And what they've been finding is that that can worsen kids' anxiety because their social network is attached to their phone, right? And you're isolating them even more by telling them no screen time, right? So I wonder what that translating that to like a PTSD like sort of picture would look like.
I fully acknowledge that, and that's actually a good point that their social network is now solely online. So by removing that, like yes, you could be increasing their anxiety levels and probably exacerbating the issue a small bit. What about, do you know the way social media platforms would say like your TikToks and your Instagrams are dopamine hits? And I definitely not pulling research from anywhere here, but in terms of the kind of quick scrolling, or people would associate it with having a short-term memory or not being able to focus, would that be detrimental to after brain injuries or anything?
Yeah, I think like leave out the whole brain injury piece. We know that, you know, being on these social media sites is absolutely terrible for people's mental health, especially people that are predisposed to mental illness, like, you know, girls aged, you know, 12 to 16 years old, for example. I don't know if you've seen the graph regarding the rate of suicides versus when social media hit the iPhone. Have you ever seen that?
I'd say I vaguely came across it, but I definitely didn't take time to
Yeah, I
focus in
mean,
on it.
you and whoever listens to this podcast absolutely needs to go on Google, look for this graph. It's basically suicidality among the age group I just described over the years, and then it has a tick where, you know, social media hit the iPhone, and there's a, you know, almost vertical spike in suicide in that age group, you know. And I just think it's very difficult to explain away that finding, other than, you know, you have children that are comparing themselves to other people constantly, and basically having a sense of worthlessness about themselves because of what they feel that they should be.
Yeah.
And you know, that leads to the ramifications that we see in that graph.
That's
So just
frightening.
in and of itself, just that is enough for me to say, hey, social media isn't good. And we can get into the nuances of, what that does to your cognition as it relates to, enhanced distractibility, it being, the sort of dopamine hit and the addictive properties of being on social media. And certainly those are also factors involved. But at the end of the day, that graph is enough for me to say it's probably not the best thing.
Yeah, I think if you relied on that alone, it's definitely a strong indicator that something's happening.
Yeah, absolutely.
We mentioned about the social support, briefly touched on kind of if someone was gaming, and like social support networks are all online now. In your opinion, do you think there is an added advantage to being in person with someone versus solely online?
Yeah, absolutely. I mean, there's a lot of cues, cognitive cues that we take from, and cognitive and interactive cues that we take from being in person, right? Both both facial expressions as well as postures and things like that, that we take from an in-person interaction that we just can't take via a video interaction, right? And developmentally, that's part of the process of learning what these sort of facial expressions and what these postures mean, right? And then based off of that, then we adjust our behavior so that in the future when we see those things, we understand them better and we know what socially to be able to do with that input and that stimulus, right? If it's just being done strictly online, that's why you see like these dating apps, right? Like you go and you see this person, you swipe right, and then you end up meeting them in person, and then you have this sort of awkward conversation, and you don't really know how to understand each other or what questions to ask, and you begin to feel anxious and you want to get out of there, right? At least that's like for the people that I talk to that are in online dating world, that is usually their experience with the whole online dating. And I think that has a lot to do with it, right? It's like you're just interacting online the whole time, right? You're looking at videos, you're comparing yourself to other people, you're not understanding social cues or expressions or postures and how you should understand them and what you should do about them. So yeah, I think it definitely there's definitely deficits involved with doing everything online.
I suppose we're lacking in exposure to these social cues as well. And I suppose that in turn, when we are out in person, could probably heighten our anxiety as well, because we're not as familiar with being in these environments or interacting in the way that you are acting in person.
Yeah, I think so. I don't think it's just, hey, you're not used to the situation, and then when you get into the situation, you get anxious, right? I think certainly that's a natural response, but then having the anxiety be something that's functionally limiting also probably has another element of it, especially in this age group where potentially we have a large portion of the generation that is having difficulty navigating their emotions, right? Like getting on this podcast, it was anxiety provoking, right? But you navigate those feelings and those emotions, and you deal with it, and I think that that's been a big deficit probably in this generation coming up. And I think a lot of that has to do with cognitive flexibility. So cognitive flexibility is being able to switch between tasks and coming up with switch between tasks simultaneously, being able to do one task while thinking about what you learned from the other task, and being able to navigate the new task. And the cognitive flexibility comes from the prefrontal cortex and involves executive functioning, right? And a lot of those processes just aren't very well developed in this age group. And certainly they're not very well developed, but there's things certainly that we can do to be able to enhance cognitive flexibility across a bunch of different ages, right? And a lot of enhancing cognitive flexibility involves doing new things, getting out of your routine, meeting new people, right? And I just don't think that people are doing that nowadays. I think people are just going about their days, doing their routines, isolating themselves, not trying to meet new people, not considering other perspectives, for example. And that, inevitably ends us at, this kind of situation that we're in now.
Yeah, do you think that's the same if you meet new people or get a new friend on Facebook, it's not exactly the same thing as what you're saying when you say get out and meet new people, right?
Yeah, all right. So here's an example, right? So I'm not gonna divulge exactly who it is, but a very extremely close, an extremely close family member. Um, had their best friend in childhood, right? And um, they reconnected via Facebook. And this was a very exciting time. They hadn't seen each other in like 20 plus years, and they were at the hip as children. And I remember this person always talking about their childhood best friend. And finally, they got reconnected on Facebook. But their reconnection, so they got reconnected via Facebook, but then on Facebook, they were very starkly contrast in terms of their political ideologies, right? So everything that they saw from this person on Facebook was the complete opposite political ideology that they held. So then by the time that they met together, they decided to meet up together after all this time. All that was in this person's mind was the different political ideology of the other person. And this meetup didn't end up being as fruitful as it probably should have been if, let's say they had never seen any of that and they were really just coming in with, this is my childhood best friend who I loved for so long, and now we're getting a chance to reconnect, right? They came in with this stipulation of this is this person because this is how they think, and they got that from social media.
What is that? I know we tend to fall into heuristics, like we want to make things as easy as possible, but yeah, it's kind of disappointing in a way that there were so many other factors, like you said, they were lifelong friends as well, and kind of one aspect of their life tended to hinder their relationship.
Yeah, I mean, we can talk about what that is in terms of tribalism, in terms of attaching your identity to an ideology, how that's probably not something that you should do, right? You should remain dynamic and flexible with the way that you think, not so rigid. But yeah, I mean, but again, I think it's the element of social media, right? That pushes the identity of this person in your mind constantly of who this person is, how it is that they think, so that once you meet them in person, you've already made up your mind in terms of who this person actually is, when in fact you haven't even talked to them face to face.
Yeah.
Right. So extrapolate that out to, whatever, right? So, you're going to meet this person on this dating app, and you're thinking that they're this based off of their bio and based off of their pictures and so on and so forth. And then you actually meet them in person, and you've already kind of made up your mind about who this person is and how it is that they're going to speak and how they're going to respond to all the questions that you have, and something completely different, right? That's not getting to know someone, right? You're not getting to know someone in that process, right? You've already made up your mind about who this person is, and you're going into that, and then that expectation is not met, and then that leads to disappointment. And I think you can extrapolate that out to a lot of different things. I've talked about Brad Stulberg a lot, and I'm sure he'll come up a little bit more in this conversation, but a big element of, he talks about performance, how to perform throughout life. And one of the big things is setting expectations, right? So, when we have an expectation about what achieving something is going to bring, right? There's a dopamine spike leading to that goal, right? So that dopamine spike is pushing you towards that goal. But then if you meet that goal, but the expectation of what you're going to get from that goal isn't met, then there's a huge dopamine dip that actually happens. And it's the same thing with drugs, right? Like if you think that doing a certain drug is going to give you the same feeling that it did before, then it doesn't, right? And they've actually found this in scientific models where, when you take that drug, there's actually a dopamine dip, once you've done it before, but it doesn't meet the same dopamine level that it did the last time, which intrinsically occurs by doing drugs over and over and over again. There's actually a massive dopamine dip, which in an addictive circuit, it ends up leading you to seek out that drug more and more and more in higher and higher doses.
By the way, over the last week, we've been really speaking exclusively about Brad as well, right? We spoke all about the heroic individualism and groundedness as well. So those who have been joining in the last week, I'm sure a lot of that is resonating with them, which is pretty cool.
Yeah, he's awesome.
Amazing.
I don't know, we can go on a tangent, but one of the topics that I've taken away myself from just talking to him is the core value principle, right? So life is dynamic, life is full of decisions. You're going to run into obstacles and stresses in your life, and it's going to be tough to make decisions. But really, if you've already set a list of your core values that you can fall back on to help you make decisions, that really helps out a lot. It's helped me tons, and I would recommend everyone to set up a core value system, like top 3 most important things, right? So for me, it's top 1 is family, right? And in my line of work, family can get sacrificed a lot. And setting that core value has really helped me to discern what it is that I will do and what it is that I won't do, and when it is that I will do it and when it is that I won't do it, right? And it's really just based off of that core value system that I learned from Brad.
In ways, when Brad speaks about the heroic individualism, it's not really being grounded to your core values. It's more so just wanting to like achieve the next thing for the sake of achieving the next thing. Maybe it's societal pressures or whatever you're feeling, but you're not really taking the time to reflect and think like, is this who I want to be? Is this direction that I'm wanting to go in? I think having those core values as guiding principles, like they just help you make so many decisions as well, and steer you in the path you want to be going in. If we digress a small bit too around the cognitive flexibility bit, intrigued me, and when we're talking, is there like specific strategies or is there exercises that you can do to enhance cognitive flexibility?
Yes. So what I love is physical activity we know helps across the board with post-traumatic stress disorder, with overall cognitive functioning, and then preventing cognitive decline and dementia. We know that across the board. But what's interesting is you can actually implementing cognitive flexibility into your exercise and physical activity could be more beneficial than just doing your routine physical activity. So this is known as open circuit exercise versus closed circuit exercise. So closed circuit exercise involves a stable environment where your movements are repetitive. So running on a treadmill would be an example of that, right? Open circuit exercise is a dynamic changing environment and where your movements are also changing too. So an example of this would be playing tennis, or what I like is martial arts, right? Open circuit aerobic exercise could be more beneficial to preventing cognitive decline than just regular aerobic closed circuit exercise. So you're hitting 2 birds with 1 stone, basically, is you're improving your cognitive flexibility, and at the same time you're doing the aerobic activity required of you to prevent the cognitive decline and hopefully prevent the dementia.
Yeah, it's such an interesting thought because I'm kind of dreading. I'm at the age now. I'll keep going while I'm relatively fit, but I play Irish football and soccer, and I just don't know how I'm going to get cardio exercise in once I retire because I can't run. If I'm just told to go out and run on a treadmill, I feel so bored. Whereas if I'm playing soccer or football, I'm like the opposite. I'll just keep running after a ball and like without even thinking about it, I'll just keep running. So I am. So now when you're speaking, like I'm kind of doing using that open circuit and kind of training, we'll say, if you want to say training both your mind and your body at the same time.
Yeah. And I mean, like there's adjustments that you can make as you age, right? Like getting involved in a brand new sport enhances your cognitive flexibility, and one that, maybe you would be able to do in an older age, like pickleball, right? Like you know why it's so popular is because of this open circuit exercise format that older people, right? We have an aging population in the United States. This is why it's caught on so much, is because you have such a popularity in the aging population of the United States, right? And they understand that it also enhances their cognitive flexibility and can prevent their cognitive decline.
Yeah, like you said, it's just a wonderful way of getting the physical exercise in, but you're also getting that mental side into. Pickleball has gone to the roof as well, by the way, in recent years, hasn't it?
Yeah, absolutely. It's the fastest growing sport in the United States. I keep being reminded of that by people that play pickleball.
W-
Um, and what's interesting is in the dementias, um, a primary finding in dementia is also all obviously global cognitive decline, but cognitive inflexibility. And especially like Parkinson's disease patients or Alzheimer's disease patients, cognitive inflexibility. But what's interesting about this is, is there a reverse causation, right? Is it in Parkinson's disease, basically there's a bradykinesia, which basically your entire body begins slowing down. You can't move as quick, you're more rigid. Now, is that the brain's response to a more stable environment? Or is it a function of the neurodegenerative process? Which is an interesting question, right? Is your brain saying, my body's slowing down, therefore, I don't really need to remain as cognitively flexible? Or is it something that occurs secondary to the actual pathology that's going on in your brain? I mean, either way, I think, we want to remain cognitively flexible. We want to remain cognitively active, because that, by and large, has been shown to prevent cognitive decline. And I think that's something that we'd all like to prevent.
Yeah, so no matter what's actually, so we obviously don't fully know what's going on yet, but either way, maybe the outcome is still the same. Like we're wanting to stay active for as long as we possibly can.
That's right. And that's the conversation about lifespan versus health span, right? Like, our medical system is really great at extending lifespan, but it sucks at extending health span. So the difference is the number of years you live, right, which is lifespan, versus the quality number of years that you live, which is health span, right? And certainly cognitive flexibility is a prime example of that.
Yeah, I suppose, yeah, there's so much focus on keeping people alive without maybe the quality of life that's not good. I think that's seriously emerging though. There's a lot of research, like yourself included, diving into that, and I think it's a good opportunity for us to segue slightly, because it's funny, when brain health is often discussed, it's more often than not when something's gone wrong. We've mentioned dementia or PTSD as well, but I'm curious from your point of view, time and what we've talked about, like what does a truly healthy brain look like to you, and maybe how can we work towards achieving that?
Yeah, I think, brain health has a lot of different definitions, right? But, I think the the definition I like is basically keeping the capacitance of the brain, so that keeping the capacitance of the brain across a bunch of different domains relating to brain functioning, like cognitive, sensory, social, emotional, so that you're able to achieve your life's full potential, and at the same time preventing cognitive decline and dementia. That's probably, that's along the World Health Organization's definition. They don't include also preventing the cognitive decline and dementia piece, but that's a piece that I like to include. But I think there's certain criticisms of a definition like that, like is it too idealistic, for example? Is it too rigid? But I think my response to that would probably be, I think I think that's a bigger question about reframing what we think our full potential really is, right? And I think that comes down to really the individual, not a health organization, to define.
Do I smell a hint of a conspiracy theory there? Do you think we're conditioned to think that health is a certain thing and we can break past those barriers?
Um, can you extrapolate on that?
You just got me thinking there when you were talking. It's kind of like, are we conditioned to believe that health is a certain way? So an example I can give is like, I am in my mid-30s now, and I even said it myself, which is interesting. I said, oh, I could be retiring from my sport soon. But like, why did I say that? I said that because I'm conditioned to once you get into your 30s, that's it, you're old now, you can't keep playing that particular sport. But you've kind of just spoke there, and now I could question going, but what if I'm able to look after my health in a certain way? Maybe I'm still able to hit key metrics that are needed for the sport. Maybe I can play till I'm 45 versus 35. I don't know. Maybe not. Maybe there's physiological reasons that will prevent me. But it just kind of sparked that idea in me in terms of like, are we conditioned to think health is a certain thing? And
Yeah, so two things. I would say, if your life's full potential, is your life full potential hinged on being able to play rugby for as long as you can?
as in, am I doing everything that I possibly can?
I'm saying, like, how valuable is playing rugby the most valuable thing in your life?
Well,
In terms of
if I
in
played
terms of
rugby, if no, I play Irish football and
sorry,
soccer.
sorry.
So
Yeah, because I think you might have mentioned rugby at some point in our conversation, but is it like, in terms of your identity, it reflecting you as a person attaining your life's full potential? You think playing soccer and football is something that reflects that?
Oh, deep question. I would have said, if you asked me 10 years ago, I probably would have said yes, but now I think I want to build out other facets to my life. Do you know, I want to be kind of known for different things rather than the person who plays football. But I will admit, it's the part of my life I get an incredible amount of joy out of. I love the competition aspect. I love the fact it keeps my body healthy, as well as I like the kind of, without getting too woo, like the mental challenges that are involved when it comes to playing a sport, the strategy side to it as well. So I see it now as a component of my life. I don't see it as like my full identity, whereas I probably did 10, 15 years ago.
Right, you probably did 10, 15 years ago when you were physically able to compete, right? Like, as well as you probably could. But what I'm saying is, you know, your identity isn't really related to the sport itself, it's related to what the sport brings you. And hopefully you would be able to find those things in other places. And when you're saying reaching metrics that then verifies that I am living, brain healthy lifestyle, do those metrics really have to be related to your participation in football? Can it be related to something else?
Is that a direct question at me? I would say it.
You
Yeah,
cut
I would
out
say
again.
it possibly. I would say it possibly could be related to something else, but I don't have a
But
something else.
Well, but that's what we're talking about here in terms of, the controversy with the definition, right? And I think the other point is, are we medicalizing things that shouldn't be medicalized, right? Like, by saying by defining it how we define it, are we then medicalizing a massive portion of the population, pretty much everybody, right? That don't need any sort of medical intervention, if you will.
Are we? If we're talking about redefining health, I just feel like everyone should be in it. It should be a proactive thing.
Yes,
Or
and I would agree with you, but that's the critique, right? Like, are we medicalizing people that don't need medicalization? My argument to that would be, well, we're using the medical system as a preventative, right? A preventative apparatus, so that people don't end up having to come to us with dementia, with cognitive with symptoms of cognitive decline. Yeah, I mean, again, I think you would agree, our medical system has been pretty reactionary to disease instead of preventative over pretty much since its inception. So I think reframing the brain health definition like this and deploying the medical system into a more preventative um, apparatus would probably be a good idea.
Is that your ideal state for a medical system? Or what's your wish list? What would you, in a utopian world, like what does it look like for you?
As far as brain health is concerned?
Let's pick, given your area of expertise, let's focus in on brain health, definitely.
Yeah, I think, ideally we would fashion policy across the board, whether that's medical, political, to be able to support the pillars of brain health, right? We know that, there's 12 risk factors that have been identified as 12 modifiable risk factors that have been identified as likely contributing to about 40% of the dementias worldwide. That's huge. That's almost half. So if we're able to actually modify those risk factors, I wonder what the dip in dementia would be if we all got on board and from a policy standpoint started supporting the modification of those risk factors.
We had someone on previously speaking about dementia specifically as well, and I remember them emphasizing just the importance of the proactive and from a young age kind of working towards. So I don't think we dove too deep into all the modifiable risk factors involved, but they just mentioned like the proactive nature is in their opinion important. I'm curious if you agree with that.
Absolutely. I mean, it's interesting, the Lancet put out the number 40%, and they were the ones that put out the modifiable risk factors. And they actually stratified them into like the early life modifiable risk factors, midlife, and then late life modifiable risk factors, which is awesome. And I would encourage anyone that's interested in it to look at it. But the early life one was just one, and it was education, right? Less education is actually associated with as a really significant modifiable risk factor when it comes to developing dementia. So when you talk about preventing from an early life, it really, really starts earlier.
Yeah. And I know progressing on like what the area you're in with brain injuries would be obviously incredibly important. And then I guess a lot of them, I think it's too vague to say they're like common sense, but they're kind of, if you probably want to reducing alcohol. Like I think we're all aware smoking and like the impacts of that as well.
So the thing with alcohol is interesting, right? Like there was a paper that just came out in 2024 looking at the 12 modifiable risk factors for young onset dementia and cognitive decline, right? So getting dementia before the age of 65. And there were 2 risk factors that were identified relating to alcohol. And one of them was no alcohol consumption, and the other one was alcohol use disorder. So no alcohol or excessive alcohol consumption. I'm like, what is that?
Wait, what? As an Irish person, I'm losing my mind right now. What's going on?
Right. So, and I don't think anyone's really come up with, a convincing answer as to why abstaining from alcohol would be a risk factor for dementia. Certainly, logically, you can think about it. We know that community engagement is like super important in terms of preventing dementia, as an Irishman, certainly alcohol is a key factor when it comes to, socialization. So that's been, a reason that's been floated out. But other than that, I haven't heard anything else.
That's actually fascinating because there's a lot of, well, I say research, but if you're listening to maybe like Huberman or Dr. Rhonda Patrick, I thought they were saying like the less is best, like 0 is ideal, is kind of that's what I've been picking up, unless I've been hearing them totally wrong, but I think they've been pretty clear with that advice.
Yeah. I don't know. Are they speaking of it from a dementia perspective? Are they speaking, in terms of
Yeah.
metabolic health, right? It's really tough to say the angle that they're coming from.
Nope.
The study that I'm referring to came out in 2024, and it showed alcohol abstinence as well as excessive alcohol, um, are both risk factors for dementia. Now, you know, it's tough with these things, right? Where it's subjective reporting, for example, right? But I thought the study was pretty good and pretty robust.
Yeah, awesome. I definitely, yeah, I'll check it out. I encourage everyone else who's listening to check it out too. What advancements in your field are you really excited about into the future?
Yeah. I think what's exciting is probably the new novel imaging technologies as it relates to functional MRI imaging and different MRI techniques to be able to help us pick up hyperconnectivities or hypoconnectivities between different circuits in the brain. Um, and then, having those, finding out how those translate then to disease states like mental illness or brain injury. Um, Also, the neuromodulation piece I think is really, really exciting. Transcranial magnetic stimulation, transcranial direct current and alternating current stimulations is something that's really, really exciting, both for disease states like post-traumatic stress disorder, and dementia too. We know that TMS can help with a myriad of different mental illnesses relating to post-traumatic stress disorder, intractable depression, as well as OCD. But I think those indications are probably going to expand in the future. And then, we've also seen some cognitive improvements in patients with dementia that receive transcranial magnetic stimulation. TMS is amazing. It's an intervention that can actually influence circuitry, either increasing connections between circuits or decreasing the connectivity of hyperconnected circuits like post-traumatic stress disorder, for example. So I think that's a really exciting field. I think the integration of AI into understanding how the brain works is going to be a really important factor when it comes to us understanding exactly how the brain works. Um, and psychedelics too, I think is going to be a key aspect of mental health and mental illness treatment moving forward. I'm very disappointed over the recent, you know, FDA knock on the approval for psychedelics for post-traumatic stress disorder. But there's a lot of phase 3 trials in the pipeline relating to psilocybin that hopefully the FDA will look at and approve of. But I think I would say those are probably the most exciting things relating to my field that I have to look forward to.
I've a few follow-up questions. The first is you actually answered it. I was going to ask when you mentioned about the psychedelics, like, is there openness to that or how is it? But it seems like a small setback, but are you confident, like the irrefutable evidence that it can't be ignored for too long?
Right. So not that the evidence is irrefutable. I think there's certain elements of the evidence that are refutable, but when you look at the state of, um, for example, post-traumatic stress disorder treatment, it's so limited, man. Like when you look at the medications that we give patients, and what that does for their quality of life and the post-traumatic stress disorder symptoms, it really doesn't work very well. So, understanding that context and then thinking about, the findings on some of the big phase 3 clinical trial papers looking at MDMA for post-traumatic stress disorder and looking at the symptom improvement in those patients, I think the evidence is, robust enough to at least, um, uh, you know, give it FDA approval with a lot of oversight after it's on the market, right? So continuing safety and efficacy studies while it's on the market and really keeping it as an intervention that's reserved for people who have tried a bunch of different medications, nothing's worked, their symptoms are really severe, their quality of life sucks, and using it for very specific people.
Yeah, whereas that like right now, it's a case of like the medications that are already in place and the treatments just might not be enough. Are you experiencing that?
Yes, absolutely.
Yeah, that's a
Absolutely.
shame when you have this
But
potential.
yeah, and it's not to say, I mean, but there's potential adverse side effects of psychedelic treatment, right? Like that we need to make sure that we look out. For example, I don't know if you have time for me to give this aside, but I was consulting for Ukrainian neurologists that were seeing their patients coming off the front line. So it's basically the Ukraine. So what was happening was their soldiers would get blown up or whatever, and then come off the front line, and then they don't have a robust sort of military sort of hospital healthcare system. So what would end up happening, they'll get stabilized at the frontline military hospital, and then they would just they would just get sent to like the closest hospital, and then the community neurologist would just have to see these patients. And what was really interesting was that these patients, the soldiers, they get diagnosed with PTSD, they get diagnosed with a concussion, and then the expectation was that they're going to have to go back to the front, right? They don't have a limb missing, right? They don't have any significant orthopedic injury that wouldn't keep them from. So like they're going back, and what do we do for them, right? Like, do you treat their PTSD? Like, do you put them on a medication that treats their post-traumatic stress disorder symptoms, or do you not? And so this was the whole context. And as a further aside was, well, is their post-traumatic stress disorder actually advantageous to them on the front line, right? Like, are we doing a disservice to them by treating their post-traumatic stress disorder, right? Symptoms of post-traumatic stress disorder are hypervigilance, right? Obviously, significant anxiety and not sleeping, right? Would that be advantageous to someone in a different sort of context, like, on the front line fighting for your life in a war, right? So that's kind of a bigger question about like, pathology is pathology in certain environments and social structures, right? In civilian life, it's an issue. Maybe on the front line, it's not an issue. It might be advantageous. But the psychedelics piece comes in where it's like, well, could we potentially treat these guys with psychedelics, right? Like, and the person I was consulting with was like, I would not do that because it's one of the findings with doing psychedelic treatment was, within a time period after doing the treatment, people want to make really significant changes to their life, right? Because of that amazing experience that they had, they feel that they may feel that changes need to be made to drastic changes need to be made to their life. And you really don't want to do that with someone in the military whose expectation is to go back and fight, right? Like, there certainly would be a lot of pushback if you had military members saying, I don't want to fight anymore, I don't want to, I don't want to have to kill people anymore, so on and so forth. So, that being said, it's like these are the kind of issues that, would need to be considered with psychedelic treatments, right? It's like, people can make drastic changes to their lives, right? Leave their families, stuff like that, that I think need to be considered, because it's not all good. There can certainly be, some negative aspects to psychedelic treatment. But that being said, right, all in all, I think it's an overall good for people with mental health issues, people with post-traumatic stress disorder.
I think that's such like a mind-twisting example you gave about being on the front lines, and let's perhaps not treat this because it could be advantageous as well.
I was scouring um, across the United States, really anybody that would be able to give me some input into what to do with these people. I could not find one person. I reached out to a lot of different people, even in the military, right? Like psychiatrists in the military, they're the only exposure that they have to military guys with post-traumatic stress disorder is when they're back stateside, you know? Um, and usually in Iraq and Afghanistan, right, they weren't fighting for their country's survival per se, right, from an invading force. they were like, if they exhibited symptoms of post-traumatic stress disorder, they would be pulled from their unit, right? And they would be, you know, depending on the severity, they would get sent back to Germany, maybe back stateside, maybe just given some time off within the country. But this other context is just completely different, something novel, never experienced before, right? And I guess the last time people would have dealt with it from a kind of a Western civilization standpoint would have been in World War II, right? Or World War One. And back then, you know, the first time that PTSD was actually described was shell shock in World War One. So certainly the treatment for PTSD wasn't nearly robust during that time period.
Just looking at it chronologically as well is just absolutely fascinating. But you're right in terms of, did you say, were you in Ukraine or just working with people who were in that situation?
No, I wasn't there. I was like remotely consulting with the Ukrainian neurologist.
Wow. Geez, that is deep, deep work.
Yeah, I mean it's I have family that's Ukrainian. Like my wife's Ukrainian. Her family, she has family members there, so I was happy to do it for
Yeah, geez, fair play to you for doing that as well. As I said, definitely not easy, even though if you weren't like even directly like there, it's still that's incredibly, oh my God.
them. Yeah,
I was gonna
and
say
I think
traumatic, but I wanted to be careful using that word.
yeah, and I think like what having this listening to the stories from my wife's family and just seeing the stories myself, listening to them from the Ukrainian neurologist, it really makes me think of, it's like when people make decisions to invade countries, and when you have these decisions being made, what is never considered is the ramifications from a trauma perspective, that you're going to provide the entire generation, right? So I don't even want to say the amount of Ukrainians and Russians that have been killed, but that's, death. But then you have to think about the other ramifications
Yeah.
of war for an entire generation of peoples as it relates to their trauma. And when you think about like the cycle of trauma, right? Certainly there's nuances, but talk about adverse childhood experiences. Adverse childhood experiences contribute to adverse mental health outcomes in the future, the development of post-traumatic stress disorder. Post-traumatic stress disorder then increases your risk for being involved in violence and in interpersonal conflict, right? So then what does that end up resulting in? That ends up resulting in, trauma, more trauma either to yourself, to another person, and to those around you, right? And then what does that lead to? If it's children, it's other more adverse childhood experiences for the next person. And then the cycle continues and continues, right? So I just don't think that this is always something that's considered when we're thinking about, when we're looking at death toll counts, the amount of trauma that some of these people are being subjected to, and then what that's going to mean for them moving forward, right? Like it's not just you can't sleep at night, you're hyper vigilant, and you're occasionally depressed. It has so much to do with alcoholism, substance abuse, chronic illness, chronic disease. People with post-traumatic stress disorder die younger. Their quality of lives are significantly decreased relative to someone without post-traumatic stress. Like what you're going to subject these people to over the rest of their lives is absolutely horrendous. And I just don't think that's considered, because you can't quantify that, right? You can quantify death, you can't quantify trauma, unfortunately.
I mean, you asked, is it considered? Like I would say no. It is not considered. Like it's never anything you'd hear really in terms of like news on the television specifically. But yeah, unbelievably well said. I don't even know how to how to kind of react to that. That was like a mic drop moment for you, Daniel. But super good to think about in terms of, yeah, what such a, when we speak of traumatic events, like I think we're at the pinnacle there, right? When we're talking, and just the severe effect that it can have, not just on the people who are, say, engaging in that this is just ramifications that can go on for generations after.
Yeah. And trauma just doesn't have to be getting blown up or getting shot at or getting assaulted, although that is probably the most severe form of trauma that leads to post-traumatic stress disorder, but also the death of a family member, right? The maiming of a family member, that sort of thing can really leave a traumatic lasting impact on the person, right? And could possibly end up resulting in post-traumatic stress disorder or other adverse mental health outcomes that then translate to decreased health span, decreased lifespan even, right? And chronic illness and disease, substance abuse. So, the notion that, this thing is just limited to people that die and those, closely around the life cycle of that person, I think that's incorrect. I think this kind of thing ends up traumatizing an entire generation and an entire society. And then what that ends up doing to the entire country, you can only think about, you have an entire traumatized country. What do you think is going to happen?
Yeah, absolutely. And I suppose in terms of the generational thing, like depending on how strong and how much the stories live, which nowadays everything's documented, it can be passed on from generation to generation.
Yes, intergenerational trauma is definitely something that is significant, that's been proven over and over again in the literature.
Daniel, I feel we could have a whole podcast on that alone. We could probably have a whole podcast on the other areas you mentioned that you're excited about in terms of the neuromodulation techniques. You mentioned AI as well, and then psychedelics. If you are open, of course, please come back. I saw you were getting a lot of like claps and stuff during the conversation, so people are enjoying the conversation as well. Before we do wrap up, I'm just curious from your point of view, has there been anything we have not discussed today that you feel is really important that our listeners should know about?
Yes, a lot, but we don't have time for it, I don't think. I'm just gonna have to come back, I guess.
Awesome.
Yeah.
That's it. That would
No,
be a
I think I
privilege.
think I think we hit the high points that we really wanted to hit. I think you did a fantastic job as expected. Um, but yeah, I had such a fun conversation with you, and I'm really honored that you'd have me on to talk about this stuff.
Yeah, I massively appreciate it. And for everyone out there listening, Daniel has become my podcast mentor without even knowing it over the last few weeks. I was incredibly nervous for this conversation, but despite the technical issues, I think we figured it out, and it was, cracking conversation. Daniel, thank you so much. This means a lot to me for you coming on.
Yeah, no worries, buddy. Thank you for having me. It was a pleasure.
Thank you so much again, Daniel. Massively appreciate you jumping on. Cannot wait to have you on again, and we'll talk to you all again soon, folks. Take care.